Hi everyone, my name is Kiran Punia and I am a research assistant and project coordinator at the Peter Boris Center for Addictions Research at St. Joseph's Healthcare Hamilton. Today, I will be presenting on our MPT pilot study, which stands for Marijuana Purchase Task Study. Specifically, the study aims to examine if the neural correlates of cost-benefit decision-making for cannabis use can be captured using functional magnetic resonance imaging, fMRI. Neuroeconomics provides a translational framework integrating economics, psychology, and cognitive neuroscience to understand the neural correlates of cannabis-related decision-making. For example, how much to purchase and subsequently consume. Considering the legalization of recreational cannabis in Canada in October of 2018, understanding the biological and behavioral determinants of cannabis use within community populations with recreational use is an important next step. The Marijuana or Cannabis Purchase Task, MPT, is a behavioral economic task that examines estimated consumption of cannabis at a range of prices, providing a measure of cannabis's reinforcing value, which is a strong predictor of cannabis use or misuse. To date, no studies have examined the neural correlates of the MPT using fMRI. This fMRI pilot study aimed to determine if the neural correlates associated with the MPT in individuals with moderate to heavy cannabis use can be captured. Additionally, behavioral choice data were also included to examine the behavioral economic measure cannabis demand. 18 individuals who use cannabis recreationally at least 2 times per week completed one assessment visit and an fMRI scan. 3 sessions of the MPT were completed during the 24-minute scan. On each trial of the MPT, participants can choose to purchase up to 14 grams of their preferred or typical cannabis strength and quality for the span of a week. Each trial of the MPT is divided into 2 major components: a consider epoch, in which participants process the stimulus information in the trial, especially the price contingencies. For example, how many grams of cannabis would you consume if they cost $1 each? And a choose epoch, in which participants behaviorally select their consumption response using a number line on the screen. For this version of the task, we've examined prices that range from $0 to $80 per gram. There are 3 different conditions or outcomes for each trial of the MPT. Approach refers to the maximum number of grams chosen to consume for the week by the participant. Ambivalent refers to a certain number of grams chosen to consume for the week that is not the participant's personal maximum. Lastly, avoid is the price at which the participant chooses to consume 0 grams or no cannabis for the week. The study inclusion criteria include non-treatment seeking recreational cannabis use. Recreational and medicinal use was fine if it was without a prescription, at least twice per week. Individuals between the ages of 19 and 55 are recruited, and individuals who purchase their own cannabis, as well as primarily use dry flower cannabis. Exclusion criteria included lower than a grade 9 education level and a history of schizophrenia spectrum, psychotic disorders, or bipolar disorder. Another exclusion criteria included greater than weekly use of other psychoactive substances besides cannabis, tobacco, or alcohol. The sample includes a mean age of 34, 8 males and 10 females were included, and 17% or 3 individuals are smokers. Examining participants' behavioral data, we see evidence for individuals exhibiting the 3 distinct components of choice behavior, including an increased cannabis consumption during inelastic phases. On the figure on the left-hand side, figure 2, Mean reaction times across conditions of the MPT are shown. Consistent with what we expect, mean ambivalent reaction times are the highest. And on the right-hand side, figure 3 shows consumption across MPT conditions. As we expect, we see the highest consumption levels for approach trials and no consumption for avoid trials as participants' consumption becomes suppressed. This slide shows the slice-outs for 3 contrasts during the DECIDE epoch. On the top left, contrasting ambivalent versus approach epochs, we see activation in the bilateral anterior insula, the caudate and inferior frontal gyrus, as well as the superior frontal gyrus. For the ambivalent versus avoid contrast, we see similarly greater activation in the bilateral insula, bilateral caudate, and the left IFG. These brain regions play a role in aspects of decision-making. This includes incentive salience and urges previously demonstrated in the caudate, interoceptive processes in the insula, and conflict monitoring in the cingulate cortex. These are similar activation patterns previously reported in both alcohol and cigarette demand studies. For example, bilateral caudate has previously been reported for smoke choices on the cigarette purchase task, and greater differential activity for ambivalent choices compared to avoid or approach choices potentially signals greater activation in these demand decision-making regions during ambivalence about the level of consumption. During the approach versus avoid contrast, we do not see any differences in activity, either increases or decreases, suggesting that most activity is driven during the ambivalent phase when prices are elastic and individuals may decrease consumption due to increasing price. P was set at 0.005 and an FDR correction was applied. In conclusion, our MPT pilot study in 18 individuals who use cannabis recreationally shows the greatest recruitment of brain areas during the ambivalent phase of the task, which is when individuals are unsure if they wish to purchase at a specific price, so this is when demand is elastic. Specifically, we see recruitment of the inferior frontal gyrus and dorsal anterior cingulate cortex, which are areas of the brain that are associated with inhibitory control, the bilateral insula, which relates to interoceptive awareness, and the caudate, signaling potential reward for participants' choices. In the future, we hope to run a larger sample and include a control group. This would allow for subgroup analyses, examining the effect of polysubstance use on decision-making and allow for comparisons to the neural correlates of purchase tasks for other commodities such as alcohol and tobacco on a more granular scale. For limitations, this pilot study includes a sample of 18 individuals who use cannabis recreationally. Future studies should examine individuals with cannabis use disorder, CUD, or those who are treatment seeking. As well, our MPT paradigm does not capture decisions to use other forms of cannabis beyond dry flower, for example, for those who primarily use oils or edibles. These findings also do not generalize to those who make decisions for medicinal use. Using this paradigm, we also cannot comment on the influence of other substances such as alcohol on individuals' decision to use cannabis during simultaneous use, for example. Participants are told to keep in mind that no other substances were consumed before making their decisions on the task. For strengths, the strength of the study is that it is the first to examine the neural correlates of the MPT. We have also examined decision-making in individuals who use recreationally, which in a larger study could provide useful information to compare and contrast between choices in those who use recreationally versus those with problematic use. Subgroup analyses will be possible in a larger study, which this pilot provides the foundation for. Ultimately, we hope that this research will inform legislation surrounding cannabis availability and pricing as it relates to cannabis misuse, as well as for enhancing therapeutic targets for existing problematic cannabis use interventions. Thank you so much for listening.